So intraoral cameras are a big piece of what I do also. And the reason is that it isn't convenient in the middle of a procedure to strip off my gloves, get out retractors and mirrors, and start taking photographs. Well, that's fine if I'm really looking to document the case because I'm going to either give a lecture or, write an article, but that's fine. But on day-to-day stuff, why? I need to document something either before and after so a patient, perceives the value of placing a composite instead of having that amalgam. Showing the patient in a situation like this, well, you have a large restoration, you have a gap between the tooth and the restoration. That's why we need to do something. And picking up an intraoral camera is so simple. You put the sheath on it, you pick it up with your gloves, you snap the pictures, it takes seconds to do, you put it back in the holder, and it's ready for you the next time you need to pull it out. Especially when you're looking at things like fractures in teeth. I use that whenever I find a fracture in a tooth because I want to be able to possibly go back and see it if maybe the symptoms didn't resolve or somewhere in the future the patient's complaining. I've got the image. I've also educated the patient through these intraoral camera images as to why we need treatment or what may be necessary further down the road. I just did that yesterday where we had a tooth that had a fractured cusp and we had to do a gingivectomy. And I showed the patient the reason that we needed to take the laser and remove some of the gingival tissue because they didn't understand why. Well, you just fixed the tooth, doc. Well, yeah, I'm going to fix the tooth, but in order to fix the tooth properly, I have to remove some of this excess gum tissue that came over the tooth. They see the picture, they understand it, they accept the treatment. And it's real important from a patient education standpoint, along with if you're diagnosing, let's say, this first molar in the photograph for a crown, send it off with any documentation that you need. Very easy for somebody to go, yeah, the tooth needs a crown. Whether it shows up that way on a radiograph is a whole nother deal, but that picture tells the story.